Welcome to NWAETC Project Echo. We're here with Jennifer Magnani, LICSW, a social worker supervisor at Madison Clinic, and she's going to talk about improving adherence and motivational interviewing. Jennifer.
Thanks, Kent. So I wanted to talk about motivational interviewing as being one technique that you can use to help your patients take their medications more reliably. So certainly adherence is a major challenge for a lot of our patients. And it's one thing to think of it as a long-term process because really adherence issues are something that are very complex to address. And there's a lot of different approaches that we can use to impact someone's ability to take medication as prescribed. Motivational interviewing is one tool, but certainly not the only tool to help improve a patient's adherence. Different things like stigma, social supports, other things that we can talk about at another presentation can also impact someone's ability to take medications. Well, why are we talking about motivational interviewing? Certainly, impacting someone's adherence could markedly affect HIV and its course within your patient and also within the general population. If we could guarantee that someone can take their medications reliably, we could theoretically slow the spread of HIV. Our patients would be healthier, and generally we'd spend less on healthcare because people who are taking their medications tend to be not suffering from opportunistic infections. They don't have some of the health concerns that people who are intermittent with their taking of medications or who don't take it at all. And it's easy, I think, sometimes to think about, well, just education as being a tool to improve adherence. You think, well, I've spent some time with my patient. I've explained to them how this all works, like how their health is doing now, why the medications are important, and particularly as patients head into a crisis state, that you try and stress really how important it is to really be taking your medications. And you think, well, I've done my job. And it's the fastest way to sort of provide that level of explanation to a patient, but there's a lot of really complex things going on for the receiver of that information that make it really difficult to just use that simple educational tool as a motivation to change their behavior. Motivational interviewing is a very proven technique for helping with chemical dependency issues, drug, alcohol addiction, and has shown a really sustained reduction in use over a period of years. But the question is, what can it do for adherence issues? What I'll say is that the research is a little murky as to exactly how it impacts adherence issues, but there is some good data out there that does say that it can have an impact. So what are we talking about when we're talking about motivational interviewing? So really what motivational interviewing is a way of being with a patient. It's not as simple as a set of questions or a 10-minute something that you'll do that's just going to completely fix the problem. It's actually a way of being with someone that shows your genuine care and concern. It's a way of being empathetic, using active listening skills, and then also moving forward in terms of asking questions that really challenge the patient to think about their behavior and to think about ways that they could be motivated on their own to make a change. It's been around, for not terribly long, since 1983, really went into widespread practice in the 1990s. And like I mentioned, it has been empirically tested and proven to be effective, and that's again in the alcohol and drug realms. Its goal is to talk about, is to guide the conversation in such a way that the client is likely to start talking about change. So how does this work? One of the major first things that you're starting off with is using empathetic listening. So you're certainly starting with open-ended questions, but really what you're trying to communicate to the patient is that you're genuinely interested in the situation, and you're ideally trying to phrase things in such a way that indicates to the patient that you completely understand that they're having trouble and that this is not something new for you, that they're not in trouble because they're having difficulties with their medication, that you're just laying the groundwork for them to be open about saying, yeah, I am having problems, and that you were expecting that and that you have warm regard for them regardless. So I provided at the bottom of this slide just kind of a sample of what you can say, because it may be that patients haven't necessarily brought up their issues with taking medications to you in the past, and it can be a way to start a conversation with someone, to suggest to them a couple different things that you might have heard. The next component is to try and develop a discrepancy, and this is the discrepancy between the patient's higher values and their current behavior. So you're asking a series of questions that again continue to convey your genuine interest, but you're trying to highlight that discrepancy between what they want to become and what they're doing right now. So what types of questions are we talking about? So here's a list of some ideas of how to get started with things. So you're remaining open-ended with your questions. You're also talking about the pros and the cons of not taking medications. And if someone's having a hard time coming up with the pros of taking medications, because really what they're coming up with is, it's just such a burden to take the medication every day, or I don't want to have to think about the fact that I have HIV, then I really start siding with them. It tends to open up the conversation towards the other side. The person then starts talking about the pros. Well, it's not all bad when I start thinking about the medications, because I do then think that my health would improve. They'll start taking that opposite side. I try and ask for clarification and examples. I think it's easy for patients to gloss over why they're not taking medications. Why are they doing a negative behavior that you're trying to impact, and really asking them to be specific. Asking them to think of kind of those outcome questions. What happens if things continue as they are? What would be different if you took your meds? And again, just highlighting, if you're really stuck, if the person really isn't going anywhere with this conversation, to try and just really side with the negative aspects. People don't really expect that. Sometimes it pushes them into an area where they start thinking about things differently. In using MI, you have to know that resistance is kind of a natural part of making any sort of change in your life. And your positive regard comes from not labeling that person as being pathologic or in denial about their situation. Resistance to change is completely normal. So it's also based on the principle that if you're pushing someone who's not ready to make a change to do something, that they'll push back just as hard to not make that same change. So to just kind of go with the resistance, to expect it, to ask, just clarifying questions and just sort of sit with them with that. The last component for motivational interviewing is to support the patient's self-efficacy. Patients can often feel like, hey, I've tried to make this change in the past and it just really hasn't gone well. I'm a failure at making change. I'm a failure at taking my medications. Your goal is to, from a place of genuine interest, to highlight for that patient what their strengths are and to try and rekindle their interest in making that change. This can have a dramatic impact on the likelihood of their success because they really would like to see themselves as you are seeing them. So some things to keep in mind. Motivational interviewing works best when you hold back on telling the patient why they need to change, and this can be exceptionally difficult. And I know that it's hard to watch someone who is really headed towards a place of medical disaster make decisions that continue to put them on that path. But the reality is people are motivated most strongly by their own reasons and motivations for change. So your goal in doing motivational interviewing is to really tap into that. And to also know that motivational interviewing is very much a process. So just because someone doesn't have dramatic results right out of the gate doesn't mean that your motivational interviewing techniques aren't worth continuing. You don't know if that patient leaves your patient encounter and continues to think about things, and that eventually maybe they are willing to make a change. And also, the last point to know is that motivational interviewing doesn't have to take a huge amount of time. You can spend simply 10 minutes, 15 minutes in a clinical visit having these conversations. It doesn't have to be a half-hour conversation. It can be if you've got that amount of time to spend on it, but really you can do this in small bites. And lastly, here are just some resources for you to kind of reference as you're moving forward with your motivational interviewing. There are certainly trainings that you can attend. Those happen nationwide, but if you're just looking for some more information, here are some good resources. Thank you.
Great, thank you, Jennifer. I'd like to ask you a few questions following up as I heard your presentation. You kind of mentioned that, or alluded to the fact that sometimes motivational interviewing process can be one step forward and two steps back. As a provider, how do you kind of maintain your perseverance for keeping to come back with the motivational interviewing approach?
I think knowing that it's a technique that works can definitely help. I think it's easy when someone is showing that they haven't made much progress, or that actually they've gone backward, to sort of jump in there and be like, hey, can I explain to you, why that's such a negative thing? And if that worked consistently, I think you wouldn't be in the mode of having to do motivational interviewing. So I would say, just kind of continue where you're at and to just genuinely express your concern and interest in this problem.
I'd like to go back to what you said about rolling with resistance. And I'm wondering if you can give an example from your own practice of how you've encountered resistance and what the process was like for you to kind of roll with these existence. Can you map out a scenario for how it played out for you in a particular example?
Absolutely. So I had a young client, maybe in his early 20s, who was having a lot of unprotected sex and showing up pretty much weekly with a new STD. And for him, he really saw the sex he was having as being sort of essential to the person that he was, and he wasn't really interested in making any sort of change. And so we talked about that, and I sided with, in that case, on the pros of having the unprotected sex, which seems like an odd thing for a clinician to do, but to say, hey, I get it, like it's the sex is more exciting, that these are mostly curable infections, like to really sort of put myself in that position so that the patient was forced to be like, well, yeah, but it is kind of a hassle to come in every week. And no, I don't know that all these guys are positive, and I would be concerned about spreading the virus, to someone who was negative. So to sort of know with him that he wasn't necessarily interested in making a change, but trying different techniques to get him to see things differently.
Great, thank you. One last question. How did you get started using motivational interviewing, and what would be the steps that you would recommend other people who want to learn this tool and implement it in their practice?
So I started using it when I really wanted to come from a place of realizing that education alone wasn't doing it. And I wanted another set of techniques, something else in my toolkit that I could use when just telling someone what to do wasn't working. So that's kind of how I started, and I've had the ability to attend a training here locally, which has definitely helped my skills. But I know folks that have started just by looking at some of the resources that I've left, at the end of the presentation, and to just try out some things. I mean, again, it's a way of being, not like a specific technique. So don't get hung up so much on the exact questions or the exact phraseology of what you're doing, but just know that you're doing a lot just by asking questions, sort of living in the patient's world for a bit.
Thank you, Jennifer Magnani.
Thanks, Ken.